I had a phone call. You need what again? I'm sorry.
We need verification that your animals are therapy dogs.
They're not therapy dogs.
So we need to know their vaccination status as part of that, because we have to worry about infection prevention for other patients that are here in the hospital setting. So we're offering you 3 choices. The first is to have your friend or emergency contact come and pick up the animals to keep them safely where you is something you feel safe with. The second is to have the animal control officers take them and keep them safe there. The third is if you do not want to be separated from your animals, you have the right to leave against medical advice. We cannot keep you here.
I'm not leaving against medical advice. If these officers decide to dump me on the sidewalk because you don't want to treat me, my service animals haven't done anything for you to question their ability as service animals, right? Because before you ask, wait, the paragraph that you were reading about the 2 questions, the paragraph before that clearly states that they didn't have the right to ask unless the dogs did something to put them in question. So, in understanding that statement, her asking without a reasonable explanation is discrimination. Why don't you read? You said you had it up. You read it. Okay, can you read the paragraph to me before, so you can speak, because obviously the case law went in one ear and out the other, and you're not. Do you have a supervisor?
I am the supervisor.
That's how you get trained?
So would you like the doctor to come in and explain your medical options to you that might help inform your decision? You asked for that previously.
Sir, if these are my only options, let's get rid of her because she's raising my blood pressure. My doctors believe that I shouldn't be in that situation. I already said, if you're not going to enforce the law, please at least let me speak to a doctor in private so I know how to deal with my leg.
Nobody's preventing
because
you.
Okay, I know you're going to dump me on the sidewalk.
Nobody's dumping on the sidewalk.
I just want to make sure that I have at least some sort of medical advice on how to deal with the poison in my leg.
Yeah, absolutely. All right. So we're out of here, okay? We're leaving. So good luck.
Hey,
Nobody's taking your dogs or anything, so we're just trying to help.
She's trying to discharge me because I'm not letting you take my dog.
That was an option. That was it. That was an option. So we're taking off, okay? Good luck with everything.
You guys, they're saying they're gonna discharge me.
No, I don't discharge anybody. I'm
A
just a
dog's
police
gonna come
officer.
in and talk to you and let you know your options.
All right, I'm not leaving here.
Dr. Roberts will be in momentarily. She's assisting another patient.
Ma'am, I'd appreciate it for my safety if one of you guys stay here, because I would like a witness if you have your body camera, if they're gonna force me to turn my camera off to speak to them.
What's gonna happen? The doctor's gonna come in, tell you your options about your care for when you leave, and that's what's gonna happen.
I'm not asking to leave. You're forcing me to leave because I don't want to be separated from my. You're forcing me to leave because I don't want to be separated from my service animals. I'm only asking that if that's what you're gonna do, that I can at least speak to the doctor and get medical advice on how to further treat myself if I can't get treatment here.
Yeah, the doctor's gonna come in.
Right there.
Okay?
Yeah, the doctor's gonna come in and talk to you.
asking.
Good luck, okay?
I'm asking if one of you guys can stay and wait, because if I'm gonna turn the camera off like they're asking and be appropriate, I'd like there to at least be a witness.
No, we're not gonna do that. Okay? Security here in the hospital. Okay?
Well, I've already recorded.
Our part is done with this, okay?
I've already recorded them committing felonies,
Okay.
and I'm asking for my protection.
Sean, Dr. Roberts,